The Healthy Living Alliance, also known as HEALA, is calling on the Minister of Health to prioritise the implementation of evidence-based policies that will address the triple burden of hunger, food insecurity and obesity, and ultimately improve the health of ordinary South African citizens. The Alliance's Zukiswa Zimela joins us now to discuss this further. Good evening, Zukiswa, and thank you very much for your time. So you are calling on the newly appointed minister to prioritise this implementation of the evidence-based policies that would address hunger, food insecurity, as well as obesity. Just talk to us about this call of yours.
Good evening, and thank you so much for having me on your show. So one of the things that HEALA, wants the minister to prioritize is the health promotion levy. So the health promotion levy is known also as the sugary drinks tax. And one of the things that has happened so far since its implementation is that the levy has not been increased. So it's been stagnant at 10%. And this is a life-saving intervention because we know that the levy works in reducing the overconsumption of sugar sweetened beverages, which we also know that are really not good for our health. And so what we're calling for is for the minister to actually look at the levy and increase it to 20%. Now, this levy is really, has so much potential because the money from that levy could be used, to increase things like child grants, to make sure that children in poor households are actually eating healthier foods. It could also be used to sort of, supplement healthier foods for people, or implement school feeding schemes for children. So there are a number of things that could be used with this levy. And so we're asking the minister to really look into it and increase it.
Pardon me for interjecting there, just on that levy. Does data indicate that, in fact, there is a significant reduction in consumption now that you would see that increase of the harmful goods?
Definitely. So we know that, when the levy was introduced in 2018, 2 years later, a study was done, and it showed that there was a significant decrease in the consumption of sugar-sweetened beverages, particularly in low-income areas such as Langa in the Western Cape. And these, we know, are often the people who bear the biggest brunt and the burden of these non-communicable diseases like diabetes, hypertension, and some cancers. And so what we're seeing now is that due to a lack of political will in the past, the potential gains of this levy are being eroded because, we know that, it hasn't been increased in any significant way in the last, since 2018, its implementation.
You attribute this problem of food insecurity to a broken food system. Unpack this concept of a broken food system to us.
Definitely. So we know, I think all of us know growing up that the way we're eating now compared to when we were younger, or even when our parents and our grandparents are younger, is completely different. We're living in an incredibly obesogenic environment. A lot of the foods that we have access to are either ultra processed or processed. And we know that these foods are often high in things like sugars, salt, and saturated fats, which are really not good for us. And so when we say, people should eat healthier, how are we giving them people that opportunity when the very environment that they're in actually doesn't offer them the opportunity to make better food decisions for themselves? And so regulations, we know, actually are one of the tools that can shift things around and put people before profits, because these big multinational companies aren't going to do them for themselves. Ultimately, what they need is profits, and profits come before people.
You also say you want the health minister to speed up regulation on food labeling to assist ordinary South Africans in making more informed food choices.
Yes, we do. So one of the things that I think a lot of us struggle with when we go shopping, so our intention perhaps is to eat healthier because, let's say, we have an ill person in the family, we have somebody who has diabetes or hypertension, and so the doctor has said make better decisions for them, or even just for ourselves, because we don't want to get sick. We try and go to the supermarkets and we look at these labels at the back of the packages, and they're incomprehensible unless you are trained as a dietitian, right? And so one of the things that front of pack warning labels will do is simplify and demystify that process. The labels will be placed in front of the food packages. So any foods that are high in salt, sugar, saturated fat, or any food that contains artificial sweeteners will have, or high levels of this, will have front of pack warning labels on the front of the package. I mean, the other good thing about this that we're really excited about, should it be implemented, is that any food that has a front of pack warning label will not be able to be marketed to children. We know that children are the most vulnerable amongst us. As you know, if you're a parent or a caregiver, and your child sees something on television or sees a particular cartoon, they are the ones who will, drive certain purchasing decisions in the home. And so this will protect children, because we know that once you have a customer in a child, you possibly have a customer for life. And so we're interrupting that addiction to these unhealthy foods.
So how do you envision this happening insofar as the exclusionary language or jargon, health jargon, that is mostly at the back of any specific product, which, as you say, is incomprehensible for many, including all of us, honestly speaking? We don't know some of these, whether what would happen if you have too much calcium, etc. So are you envisioning a situation where it's simplified, but beyond that, there's some sort of a campaign to teach people more about the more simplified terms that are there, even if it's perhaps images?
For sure. I mean, I think definitely I like that you touched on the image part. We know that South Africa, some people in our society aren't, literate in English. And so what the labels will look like, there will be a black and white triangle with a exclamation mark and a warning. And so there'll be a picture of the particular ingredient. So a salt shaker for salt, etc. So these are actually things that, and these mimic sort of like a traffic sign. And I think even, for the literate and the not literate among us, it kind of bridges that gap between everybody, and so it simplifies it for everyone. I think last year when we went campaigning for this, we had a number of people who said they actually really wanted it for their elders in their family, and one of the things that perhaps could be done once this has been implemented is to make it also into African languages, just so that it's more it cuts across everybody, and everybody's able to access this information, because I think we're being cut off from good decision making by this complicated information that we can't really understand.
And diabetes is honestly among those that have become silent killers now, and not just killing the elderly, Zukiswa.
Oh, of course. I mean, I think overall diabetes is the second biggest killer in our country. And that should be shocking for all of us. It used to be that this disease was something that you see in elderly people. And now it's something that you see across the spectrum, right? And we know that diabetes isn't just, something that affects one organ in the body. It affects the eyes. It affects, multiple organs in the body. And so it is a really devastating kind of illness that could be prevented, right? By using multi-pronged approaches, including front of pack warning labels, including, the HPL and other sort of interventions that government can come up with to kind of protect us from this. Things didn't happen overnight. And so I think one of the expectations is that once certain things are implemented, we'll wake up in 2 years and find that things have shifted. I think what we're asking for is for some movement to start happening. And so once we figure it out, we build the car as we go, because if we stop, this is, the danger, delays, we say in HEALA, delays mean death for a wide range of people.
Zukiswa, let's hope the health minister does take heed of your call. Thank you very much for joining us this afternoon. That's Zukiswa Zimela, HEALA spokesperson.